So how do we know when someone's having a stroke? What are the symptoms? Sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, is a sign of a stroke. Sudden confusion, trouble speaking, or weakness in the face, you'll see a facial droop, that can be a sign of a stroke. When you have sudden trouble seeing in one or both eyes, and patients will often describe it as they feel like they have a curtain that comes over their eye, that can be a sign of a stroke. Sometimes it's as vague as having trouble walking or drifting to one side or the other, some dizziness, or all of a sudden the patient has lost his balance. A sign of a hemorrhagic stroke or a bleeding stroke is a sudden severe headache with unknown cause, and often a patient will describe this as the worst headache of their life. So if you witness someone having a stroke or you suspect that somebody is having a stroke, what should you do? Well, you should know the Act Fast test, and it's simple. You ask the patient or the person that you suspect who is having a stroke to smile. If they have a droop on one side, that's one sign that they may be having a stroke. A for arms. Ask the patient to raise both arms. If not able to raise both and one of them drifts on to the side, that may be a sign of weakness and that they may be having a stroke. Ask the person to repeat a simple phrase, and all of a sudden slurring or strangeness or inability to get the words out or to actually pronounce the words that wasn't there before can be a sign of a stroke. And if you do observe any of these signs, it's your job to call 911 immediately.